Good morning. Welcome to the introduction video to um, bioethics, the second 8-week course. It began this morning. I always like to start with a little personal touch. So I open up with a video of my expectations and an outline of the course. This is an accelerated course, and I think, well, I think each and every one of you understands that. But what you may not understand is, the amount of reading that is going to be necessary for you to successfully complete the class. This is a difficult course. That being said, there's no reason that you cannot be successful, but you need to come into it with your eyes wide open. Again, this is Bioethical Issues in Sociology. I'm Dr. David Myers. I'll be your instructor this term. It runs from the 21st of October, and it is pouring down snow outside. Welcome to my study, by the way. It's pretty messy, but I'm looking out my window, and oh my goodness. You've heard the song before, I'm dreaming of a white Halloween. If you haven't heard that song before, well, welcome to Minnesota in the wintertime. October 21st to December 20th. And so it's an 8-week course. Usually, you've got 16 weeks to make it through all of the material. Now, I'm going to go right off the syllabi here, which you can get on D2L, but this course is an introduction to bioethical issues that arise in the contemporary practice of healthcare and which are central to understanding healthcare in contemporary society. In addition to developing a basic understanding of standard moral theories, issues that arise within American culture for patients, providers, and planners of healthcare are examined. Examples of such issues include, but are not limited to, abortion, euthanasia, patient rights, informed consent, healthcare distribution and reform, genetic testing and research, and cloning. I'm not going to go over there are no prerequisites to this course, but it is a philosophy/ethics course, and so it really helps if you've had an introduction to ethics. If you haven't, that's okay. We're going to be going over some of the same material in the opening weeks. But other than that, this course is very, very case study intensive. I'm not going to talk about competencies or critical thinking, but I will talk about methods to assess competence. Um, First of all, required reading. You must keep up on the reading. At the end of the course, you'll turn in a report that says, I, state your name, have completed 100% or 90% or 80%. Whatever percent of the reading you completed, you'll turn that in and you'll get up to 10 points. Now, if you say you've completed 4.5% of the reading, then you're going to get 4.5 points. So you need to be aware that reading is worth up to 10 points. Examinations, and we'll talk more about those. Writing project, you're going to, and again, we'll talk about that, but that's another way that I assess competence. Case studies, you'll turn in 3 or 4 of those, and we'll talk more about those in a moment, and discussion boards. Your textbook for this course is Vaughn's Bioethical Principles, Issues and Cases, Bioethics. You'll need to have the textbook. Reading, again, is 10% of your grade. Discussions are 10% of your grade. So you're going to go to the discussion boards, and each student will begin a thread, one thread for each section, and then you'll respond to 2 other threads per section. This will get you more involved with your classmates, and it will help make the material more practical. The postings must be thoughtful and detailed. One-sentence postings consisting of a sentence such as, oh, I totally agree with what you just said, will not count towards the required postings. This is an important section because you're not in your classroom. You're not taking this lecture style. And so to really get the most out of a discussion type course, you really need to participate. The other thing is, you need to read all postings. You'll get 1 point for each posting you make, and then the last 2 points come from how many postings that you read. If you want the full amount for each section, you need to read all the postings. Exams. The course is broken into 4 sections. Each section has a corresponding examination consisting of 10% of the final grade. Added up, these examinations make up 40% of your final grade. I have practice tests up that will help you prepare for the exam. Each and every one of the questions for the exam is taken directly from the practice tests. There are no trick questions. If you want to do well, you're going to have to keep up on the reading, and you could take the practice test as many times as you wish. And that will give you a look at where the test questions are coming from. It will give you a look at the actual test questions. Now, bear in mind that there may be 90 questions on the various practice tests, and I'm only going to test you on a portion of those. So what you see is what you get. Case studies. There is a case study assigned for each unit. Complete it and place it into the appropriate drop box. Writing project, term paper. You will have to write a term paper on some ethical topic of your choice. It says in the, excuse me, tongue-tied. Been at Camp Ripley all weekend. I'm trying to catch up. The student shall confer with the instructor about the topic before proceeding. You don't have to do that. But make sure if you wish to confer with me, feel free, because you can't have a topic that's too broad or too narrow. You're going to need to have at least 7 pages, but no more than 9. And so your topic is going to have to be something that you can find enough material on. Written in APA format, double spaced, with a title page and an abstract and a works cited page. Those don't count towards the content. So if you write a 7-page paper, you're going to have at least 10 pages, because you'll have the title page, the abstract, and in addition to that, you'll have the works cited page. Let's see. In your paper, you must cite at least 3 sources other than the textbook. I've linked to some excellent sites about APA formatting. In your paper, you're going to have quotations from other works. If you don't, I will have to subtract points for that. And here's the kicker: failing to turn in the term paper will result in a failing grade of the course, regardless of how many points you have in the other sections. You must turn in a paper or you cannot pass. Now, the paper is due 16 December by midnight. All assignments must be turned in on the dates given in the course schedule. Exams must be taken on the set dates unless arrangements are made in advance of the day of the exam. No problem. We'll go over the exams more in a couple of moments, but I give you a full week to take the exam, so you're not going to have trouble fitting it in. All right, all this being said, if you have questions, if you have concerns, pick up the phone and call me. My number is at the top of the syllabi, 218-308-0841. All the time, very few students call. And when they do, they're, "Oh, I'm sorry to bother you." You're not bothering me. I have a job because of you. Thank you. If you didn't take this course, I wouldn't be employed. And so my time is your time. Call me if you have a question. Shoot me an email. I check the things 3 to 4 to 5 times a day. If I don't get back fast enough, call me. I will answer the phone. And so, all right. Grading, 100-point total scale. And again, failing to turn in the term paper will result in a grade of F. I grade A, B, C, D, F. 60% and higher is a D. 70% and higher is a C, and so on. Let's see, your first exam covers chapters 1 and 2, and it will be 28 October, so it's coming up. Next week, you have your first exam. 28 October through 4 November. Then, 11 through 18 November, exam number 2, covering 3, 4, 5, and 6. 25 November through 2 December covers chapters 7, 8, 9, and 10, and your last exam will be the 9th through the 16th of December, and that will just cover one chapter, chapter 11. Your reading and assignment schedule. For November, you will have read chapters 1 and 2, and you will have completed case study 1. Now, the case studies aren't that difficult, but I do expect more than one paragraph. You really need to put some effort into the case studies. Let's see. 18 November. By 4 November, all postings on the discussion board section 1 have to be made, and all postings have to be read. If you haven't, you lose points. You cannot make discussion points up. Don't ask me. If you don't get them, you lose them. 18 November, all extra credit work for exam cycle 1 must be turned in by this date. The student will have read chapters 3, 4, 5, and 6. Case study number 2 is due at this time, and discussion boards have closed. 2 December, same thing. All work must be turned in, discussions must be made. 16 December, all the rest of the work needs to be turned in. 20 December, all extra credit work for exam cycle 4 must be turned in. Course closes at midnight, and grades will be turned in the following day. Okay, let's look at D2L because it contains quite a bit of useful information. Now again, I want you to call me if you have questions, but here's the kicker. Read everything on D2L. If you read everything on D2L, it should answer all of your questions, all of your normal questions. So go to the table of contents, and you will see instructor information. It will tell you just a little bit about me, who I am. Go to assignment information, and you will find the bioethics syllabus and schedule. Then go to assignments, and you will find instructions. First of all, instructions for the term paper. It tells you the topic is to come from somewhere in the field of bioethics, except I'm putting no more papers on abortion. I can't take it. Over the last 16 years, I've read hundreds and hundreds of papers on abortion. So anything else is fair game, but not abortion. It can be, for instance, on the ethics of bioengineering versus various strains of cattle. You're going to ask if this is ethical, and you're going to make a case for both sides, yes and no. And then finally, you're going to present your opinion in the conclusion. I have links here to some excellent sites at the University of Wisconsin that will help you format your paper correctly. All I ask is that you make an attempt. It's a research paper primarily with an opinion conclusion, so you're going to be using other people's work. You're going to be using other people's research. All I ask is that you cite it correctly. It's not plagiarism if you cite it. If you present it as your own, it's plagiarism. Boom, you fail the class. Not only do you fail the class, but it's in question whether you can continue at the university. Let's see. That's the term paper. Instructions for the discussion board. Boom. Entries made after the following dates will not count for grade, but it tells you exactly what you need to know about the instructions for the discussion board. Extra credit, I've mentioned it, I haven't talked about it. I don't want you spending the entire 8 weeks worried about your exams. I'm more concerned that you worry about the reading and that you worry about getting something practical out of the course. To that end, if you get a 52 on the exam, Open your exam, write a short paragraph on each question that you missed. Brevity counts, so be short. Give the correct answer as well as a justification. Place it in the drop box before the next test cycle. And if say you got a 52 and you do this, I will raise your grade to a 70. If you got a 73, I will raise your grade to an 80. If you got an 82, I will raise your grade to a 90. If you get a 96, don't turn it in. An A is an A. There's no A pluses, there's no A minuses. My experience has been that very few of you will use the extra credit, even if you need it. The people that use the extra credit are the hard chargers who they've got a 97 total on the exam and they want that 100. Not going to raise your grade. If you have a 92, I'll raise it to 94, but that's as high as I'll raise it because an A is an A is an A. All right, that's information on the extra credit. You can read the rest of these for yourself. Again, if you have questions, call me. Send me an email. Keep up on your reading and you will do very well in the course. All right, that's all I have for you at this time. Have a wonderful semester.